Cholesterol is vital for our existence. The problem is with too high of an exposure over years, it slowly causes plaque buildup in the artery lining. For most Americans, that artery disease starts around the age of 10 or 11 years of age and slowly progresses as we age until clinically it becomes a symptom of some type and causes us to die of the nation's #1 killer, heart disease, especially if left unchecked. So the WellSpan Cholesterol Care Program is more adapted for the garden variety cholesterol issues. The basic stuff such as, should this patient be on a cholesterol drug or could we do this with just diet? And if they're seen by a provider in the cholesterol care program who feels they need to escalate the patient's care to the Advanced Lipid Care Program, we're fully able to help these patients, whether they see us in the clinic in person, via a telehealth visit. We also see in the Advanced Lipid Care Clinic a lot of these genetic cholesterol problems.
The one thing that I think I noticed the most about my care is that the physicians treated me as an individual and as a patient. They were truly in it to make a difference for me as a person in my healthcare. I don't meet any of the criteria for someone that would historically have high cholesterol. I'm at a healthy weight, I'm fairly active, but because of my family history, it's sort of in my genes, as they say. And so genetically, I was going to have a cholesterol issue. And even with medication, it wasn't well controlled. The lipid clinic solved that problem for me, and within about a 4-month period, my levels started to come down. The other nice part of the lipid program was they did genetic testing, and when you're not sure exactly what else you could possibly have wrong with you when you think you're otherwise healthy, having that extra piece of the medical puzzle was really interesting to learn anything else that could possibly contribute to an early death or a disease process that you could catch early and treat.
So Melinda is a patient that I had the pleasure of evaluating in the office, and I recall making her aware that she was carrying artery disease in her heart that had been silent for some time, and showing her the CAT scans and the calcium buildup in the arteries of the heart. We talked about therapies. Unfortunately, I recall that she had some issues with some of the garden variety medications we use, and now we've got her cholesterol much, much lower. She's on an injection medication that works for her, that she tolerates, and she couldn't be happier, especially since we also took the time to go over diet and lifestyle. So between the injection medication that she tolerates and the dietary practices she's implemented, she's been able to reduce her cholesterol, and those numbers just drop like rocks. So I think WellSpan is really engaged in personalized care. We have all the full faculties that we need to treat any and all patients here. We do have a full staff of registered dietitians and cardiac nutritionists.
The fact that WellSpan has a cholesterol care program that includes not only highly trained physicians, but genetic counselors, dietitians that can work with the patient as a whole makes a big difference. They also communicate really well with your primary care provider, so you have that tag team approach for making sure that the patient's getting the best care possible. And they're available anytime that you have a question. You can send a portal message or a chat and just say, hey, I have this question, or I'm having this issue, can you help me? And the fix is simple. It's just taking that first step to get in touch with the doctor and make an appointment.
Taking care of yourself is the best thing anybody can do. Avoidance of smoking, regular whole plant foods in your diet, and regular exercise are the cornerstones for good reason. Doctors are here to serve and provide counsel and education. Patients' concern is my concern, so if they are concerned about such things, we would be happy to see them, whether it be in our cholesterol care program or our Advanced Lipid Clinic.